Coming up to 25 minutes after 5, local news and weather in about 5 minutes. A new report out from the Canadian Mental Health Association has found that 94% of Canadians want more funding for mental health care. The CMHA says that while work to reduce stigma is important, the funding should match the need. Sudbury's Adriana Gorski knows the issue both personally and professionally. She is a registered psychotherapist and the mother of a child with attention deficit hyperactivity disorder. I had a chance to speak with her earlier today. So your daughter is a teenager now, but take me back, I guess maybe can you tell me a bit about the care she needed growing up?
When she was a preschooler was when we first tried to access care. Family doctor referred us to a pediatrician. Eventually, after several years of monitoring and trying to do behavioral intervention, diagnosed her with ADHD and prescribed some medication at that time.
What was her behavior like growing up?
Very restless, unable to concentrate, wouldn't follow through on instructions, constantly forgetting things, even the things that she knew. Often la-la land is how I put it, daydreamy kind of thing. Hyperactivity, particularly if she ate something that had wheat or dairy. So for her it was diet-influenced hyperactivity. When that was controlled, then there was less of it.
What was it like to get access to care at that time?
It was rather difficult. The doctor, we were in a rural community at the time, about an hour away from a major center, or major for Northern Ontario. The pediatrician was in that center, so it involved having to travel to that center fairly consistently.
In your position that you're in right now as a psychotherapist, is that still pretty common? Like, do you see people still having to travel and having to go far distances to get the care they need? For
sure. If they're anywhere, even in Sudbury itself has lots of the communities that are outlying that easily can be 45 minutes, an hour drive in.
Yeah. What do you hear from other people, like patients? Like, do they ever talk about how it's difficult to get care these days?
Yes.
What do they say? Could you elaborate on that?
I didn't realize it would be such a long wait. I didn't know where to go. I didn't know where to turn. Those types of things. The doctors usually refer to pediatricians. If they're referred then to a child psychiatrist, 8 to 12 month wait is what I've been told. If they're referred to the Child and Family Center, those are both the publicly funded systems. Then it's 2 to 3 month wait. Not so bad here as it was when I was taking my daughter.
Yeah. Is that usually the main issue when it comes to trying to get care? It's just you have to usually travel far to get it?
And perhaps also the level of care that you need. Like a psychiatrist is harder to access.
Oh, I see. Very limited.
That's right.
So is there a solution to that? Like, is there another way around it aside from just throwing more money at the system?
I think there could be. There has been a move in the school boards, for example, to have social workers employed, and I think that provides especially access for adolescents to get more direct care instead of having to be taken to the school and driven somewhere else. So I think that's a great move. Also, video conferencing technology, I think, could be utilized more effectively for some of these outlying communities.
And what is that?
Video conferencing. In our case, it was used to access a child psychiatrist. We had none in the community that we were in at all, like even the more major center. So someone from Toronto was accessed for further input regarding medication and even changes in her routine. So that enabled us to access care that we normally would have to drive, 10 hours, stay overnight, and drive 10 hours back for.
Adriana Gorski, a registered psychotherapist in Sudbury. She is also the mother of a child with ADHD. 28 minutes after 5 on CBC Radio 1. I'm Jason Turnbull. This is Up